bring in public health expert Alero Roberts, who joins us via Skype for more on this grim milestone. We're told that the US, India and Brazil make up nearly half of the total number of deaths. Do we know now what the factors are that make the numbers higher in this part of the world?
Oh, definitely. I did have a good look at that, and actually it's 1,825 and counting. So every minute another person is dying of COVID. Basically, the countries that are the top three countries reporting the highest rates is a combination of poor policy implementation and social anger. There's definitely a case to be made, because when you compare the countries with the highest mortality rate with the countries with the lowest mortality rate, the key difference that I see in all of this is community engagement. In the countries that have very low infectivity rates and very low number of deaths, we find that there's a lot of social engagement with the government, and they stick to the rules and regulations because they want to, not because they're being forced to. When you're now looking at the US and Europe and the UK, you're finding that they're going into a second wave. The government has called for a second wave of lockdowns, and there's social anger and frustration, and they're now being threatened with fines for not keeping to the rules. So there's something to be said for policy implementation, and most importantly, community engagement.
Dr. Roberts, let's bring this home. 1,111 deaths recorded in Nigeria. That is huge. But it's also very little when you compare it to figures from other parts of the world. There's a sense here that the numbers are dwindling fast, even though, government agencies say we are doing little with testing. But is there anything to be concerned about the new waves you just talked about in other developed countries?
Well, the truth of the matter is you are very correct. We just haven't seen the magnitude of illness, death that is being seen in the US, UK, and Europe. And most and generally, according to the African CDC, it is most generally likely to be due to the fact that over 50% of the African population, or in fact, the numbers he quoted was 70% of the African population are aged 30 and under. So we have a largely young population. So while we are not suffering the ill effects of the virus as a disease, do not forget, we are suffering the ill effects of the virus as a social disaster. The disruption to work life, the disruption to supply chains and whatnot. But that is to say that now, if we are talking about ramping up the testing within the national testing week, that's all very good, because it will then go to prove whether or not the dwindling numbers we are seeing are as a result of less testing, or the fact that maybe many more people have been exposed to the virus one way or another. Well, certainly only the one way is by disease.
I'm going to have to just hold you there, Dr. Roberts. Thank you for your contribution. We're going to have to hope that the numbers keep going down and that Nigeria doesn't record another wave. Alero Roberts, as a public health expert, thank you for your contribution tonight.
Thank you very much for having me.